Dealing with the heroin crisis right here in our state, lawmakers now getting involved with a number of overdoses after there have been a number of overdoses in our state.
Yeah, in less than a week, there have been 18 of them in New London and surrounding towns, along with at least one person dying from this. News 8 Tina Detail live in New London tonight to show us what officials plan to do. Tina.
You know, the overdoses here in New London and surrounding towns are really shining a light on this ongoing problem. As you said, there are new numbers tonight. 18 overdose cases brought into Lawrence Memorial Hospital, 5 on Saturday and 5 since Saturday up until this very afternoon. Now, we also have learned, unfortunately, that a U.S. Army veteran, a 28-year-old Uncasville man, also died of a heroin overdose in a bathroom at the VA hospital in West Haven. That was just before Christmas, so this is reaching many lives.
As of Monday afternoon, the total number of heroin overdose victims has now reached 18. 5 arrived at the Lawrence Memorial Emergency Room since Saturday night.
The New London Fire Department transported 9 patients since last Friday related to possible heroin overdoses.
The other victims came from surrounding towns like Waterford and Stonington. One person passed away, never making it to the hospital last week.
Opiate addiction affects everybody in every socioeconomic group out there. It doesn't matter what race you are, doesn't matter if you're rich or if you're poor.
New London police continue to try to track down the source of this dangerous drug, which the deputy chief says has made its way into mainstream society now, a growing problem gaining national attention.
The arrest that made you face reality, yes, and that began to turn you around, yes.
Senator Richard Blumenthal, who says there were 415 overdose deaths in Connecticut in 2015 compared to 195 in 2012, met with experts, educators, and young people in recovery at community mental health affiliates in New Britain. He is hoping to identify ways federal resources may be able to assist.
People come back from treatment, and we don't have the resources to support them long term.
I think if there's like a central clearing point for all these agencies in the region or in the state, so we know where to send people for resources, so if they want to get clean, we know where to send them to help them out.
No, police tell us they cannot say exactly how much more of this lethal strain of heroin is still out there, but nonetheless, this heroin problem apparently isn't going away anytime soon, so the dangers will be out there for a while. We're live in New London. Tina Detail, News 8.